recently read an article about experimenting on animals like me. It talked about people who support it and people who don't. Some people say that it is good for medical advances, while others say it harms the animals and is really ineffective. I want to see what my close friends Lacey and Cagney think about it. I know that Lacey opposes the idea that experimentation on animals should not be allowed, while Cagney believes it should be something that needs to be stopped or at least tinkered with, so there are some rules on experimenting. What do you think, Lacey?
Well, being a scientist myself, I definitely think experimenting on animals is helpful to advance medicine. Thanks to animal research, primarily in mice, cancer survival rates have continued to rise. Modern surgical techniques, including hip replacement surgery, kidney transplants, heart transplants, and blood transfusions, were all perfected in animals. We wouldn't be where we are today without experimenting on mice and other animals. Herceptin, a humanized mouse protein, has helped to increase the survival rates of those with breast cancer. It could not have been attained without animal research in mice. The development of tamoxifen in animals led to a 30% fall in death rates from breast cancer in the 1990s. Therefore, animal research is needed for the medical society.
I see what you are saying, dear Lacey, but there are a few points I have to bring up. One of them is 95% of drugs fail in human trials despite promising results in animal tests, whether on safety grounds or because they do not work. Why would we take the time to hurt these animals, our friends, if the results are not showing? I understand how there might be some very rare cases where mice and other animals help with cures for cancer, but did you know that despite the use of over 115 million animals in experiments globally each year, on average only 25 new medicines are approved annually by the leading drug regulator, the U.S. Food and Drug Administration. Many of these are for rare diseases. Also, using mice and rats to test the safety of drugs in humans is only accurate 43% of the time, a recent study found. The genetic makeup of humans is just not that close to rodents, so the experiments don't really help anybody. Of over 1,000 potential stroke treatments that had been successful in animal tests, only approximately 10% progressed to human trials. None work sufficiently well in humans. Also, aspirin is toxic to many animals, including cats, mice, and rats, and would not be on our pharmacy shelves if it had been tested according to current animal testing standards. Animals do not get many of the diseases we do, such as Parkinson's disease, major types of heart disease, many types of cancer, Alzheimer's disease, HIV, or schizophrenia. And these are major diseases that really need to be looked at. Therefore, testing on animals is just something that overall needs to be stopped because it's not really that effective.
You make some good points, Cagney, and I know our dear friend LT and Poppy can help us come up with a compromise.
I see how passionate you guys are about this, that I know Poppy and I can come up with a solution.
Rules need to be established for what can and cannot be done to animals while experimenting. Everything needs to be done humanely. It should only be used in dire situations and for diseases that have a big impact on our day-to-day lives.